Pre-eclampsia is one of the leading causes of maternal mortality, or what some people call death of a woman during pregnancy. Every woman who plans to get pregnant, every woman who is pregnant must understand what pre-eclampsia is. In this video, we would like to look at what pre-eclampsia is, what causes it, how it can effectively be detected and treated, and finally, how you can prevent pre-eclampsia.
Ask Dr. Uthuman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Uthuman YouTube channel, a channel where you learn medicine at the comfort of your living room. I told you if you'd like to get in touch with me to have a private chat, go to my website www.druthuman.com and book an appointment. And if you'd like to also get in touch, you can go to all our social media handles. The name is Ask Dr. Uthuman. The topic I am discussing today is of a great concern. This topic will concern every woman who intends to get pregnant, every woman who is currently pregnant. This is very important for you. I have had several questions in my inboxes on all our social media channels, people asking about pre-eclampsia. I may not go deep to read everyone's question, but I will answer it like this. Pre-eclampsia. What is this monster called pre-eclampsia? Pre-eclampsia, first of all, is one of the leading causes of maternal child death. By maternal child death or maternal death, we mean a woman dying when she's pregnant. Very, very unfortunate. This is a person carrying another life. This is a human being carrying another life inside her womb. This is a person not supposed to receive any problems. But guess what? Pre-eclampsia has claimed a lot of lives. And that's why we must discuss about this for everyone to know how you can prevent and so on. What is this pre-eclampsia I'm talking about? Now everyone is wondering what this pre-eclampsia means. Colleagues, in brief, pre-eclampsia means, or it's a condition that happens at 20 weeks of amenorrhea. It happens when a woman is pregnant and she reaches 20 weeks. What happens is that there is a sharp increase in the blood pressure. There is an increase in the blood pressure, or a woman becomes hypertensive. A woman was normal but becomes hypertensive at 20 weeks, followed by increase in the levels of proteins in urine. What people call proteinuria. Scientists call it proteinuria. There is increase in the levels of urine the levels of proteins in urine. And this is also coupled with or without edema or swelling of the body. This swelling usually begins from the feet. I don't know if you guys are understanding. When a woman is pregnant and reaches at 20 weeks, then she starts getting hypertension or high blood pressure. The legs start swelling, coupled with urine which contains proteins, a lot of proteins. We term that as pre-eclampsia. Now you're going to ask me, how will I know that my urine is having a lot of proteins? How will I know that I'm hypertensive? This is what brings us to the signs and symptoms of pre-eclampsia. This monster presents like this. A woman is at 20 weeks or above. 20 weeks and above. A woman gets high blood pressure. By high blood pressure, we mean a systolic blood pressure. You see, when you go for blood, to check for your blood pressure, they usually write 120/80. 79/. So that figure that is up in mathematics, we call the numerator. That numerator is what they call the systolic blood pressure. So if the systolic blood pressure is equal or above 140, we shall term that as high blood pressure. Then if the diastolic blood pressure is the one that is down. So when we say the other one is the numerator and the figure down, we can term it as the diastolic blood pressure. So if the diastolic blood pressure is above or equal to 110, then we can also start thinking about high blood pressure. But now, this should be the blood pressure of that nature. To call it preeclampsia or hypertension should be taken at least on 2 different occasions with 4 hours apart. Take the blood pressure of a woman above 20 weeks. If it's 140, above 140, and also above 110, that is the diastolic, taking it at least 2 times with 4 hours apart, we start thinking about preeclampsia. Now, when this woman, when you check the urine and you find that there is a lot of proteins, how will a normal person know that this urine contains a lot of proteins? Of course, this is a test which is done from the hospital in the laboratory. But you can also know, when you put your urine in a container or in anything, and you see that the urine is frothy, it has a lot of foam, it has a lot of bubbles, then that urine is likely to be having high levels of proteins. So if there are high levels of proteins, that is another sign of preeclampsia. So if you have high levels of proteins, they have checked your blood pressure, it's high. When you urinate, you find that your urine is having bubbles, is frothy, is foamy. You should get to know that it may be preeclampsia. Now, some other women also develop severe headache. You wake up in the morning, the headache is too much, you take a painkiller, it subsidizes for like a few hours, the headache is still too much. It should alert you. Another issue is loss of vision. Some people get blood vision, others feel like they get pain when they look into, when they go into the light. When they just move outside, it's shining, they lose the vision, they feel like they are having pain. That is also another sign that probably you may be having preeclampsia. Another issue here is decreased urine output. You are a woman who has been urinating at least 3 times in the morning. You wake up, you urinate, then around maybe 11 a.m. or 1 p.m. you urinate, in the evening hours urinate, and then before bedtime urinate. Maybe 3 times or 4 times in a day. Or actually, pregnant women usually urinate a lot. But when your urine output decreases, whereby you're urinating once in a day, or even none, it is one of the signs that you may be having preeclampsia. Another sign, this is also detected from the laboratory, is decreased levels of platelets. What are platelets? Platelets are the blood vessels. You know, are the blood cells. You know, when we talk about blood, blood has several components. There are white blood cells. These are cells responsible for fighting the infections, fighting their immune cells, the blood cells. Then what we call the defense cells. Those are the white blood cells, or what they call leukocytes. Now, there are also red blood cells. The red blood cells are the ones that produce hemoglobin and so on. Now, but what we are interested in are the platelets. The role of platelets is to cause clotting. So, actually, when you cut yourself, you'll bleed. But what will bring about the clotting, stoppage of bleeding, will be done by platelets. Therefore, people with very low levels of platelets have a higher tendency of bleeding, the nose bleedings and other bleedings. Actually, when people with the low platelet levels may not clot. When you cut them or anything scratches them, they will bleed until some interventions are done. Now, when you discover after going to the laboratory, they do a CBC, a complete blood count, and tell you that the levels of your platelets has decreased, then you should also, it should click into your mind that you are having preeclampsia. Then there is also difficulty in breathing or shortness of breath. But now this will come when the condition is really severing. The condition is severing, that's when you have shortness of breath. Other people, actually most of them, around 60% of people with preeclampsia will experience upper abdominal pain. Usually when a woman is pregnant, they have this lower abdominal pain, the pelvic pain and so on, pain below the umbilicus. But when you start getting pain above the umbilicus, the upper abdominal pain, when you do not have ulcers, then you should also be suspicious that you may be having preeclampsia. Another and the last sign of preeclampsia is vomiting. I understand that when a woman is pregnant, they usually vomit. But if it's not been your nature, you've not been vomiting so much, you've reached, because most women will vomit in the first month, second month, but you've not been vomiting, and all of a sudden vomiting begins, it should click into your mind that, my sister, you may be having preeclampsia. Now, after understanding the signs and symptoms, or how it presents, we need to know what causes it, because you can't prevent something when you don't know how it comes about. Now, most studies have revealed that the biggest problem is the placenta. Someone is going to ask themselves, how is a placenta a problem, yet a placenta is one of the main structures we require during pregnancy? Now, this is what happens. As much as the placenta is the most important structure during pregnancy. How? Because it provides the nutrients, glucose, blood, oxygen, everything passes through the placenta to the fetus from the mother. In other words, the placenta provides a vital communication between the baby in the womb and the mother. It's the one that links the two. Remember, the baby feeds on the mother's blood. The baby feeds on the mother's nutrients. The baby feeds on the mother's water. Whatever, everything the baby gets is from the mother. Now, what happens is that when a woman conceives early during pregnancy, there is formation of the placenta. During this formation of the placenta, the brain will cause or stimulate formation of intensive blood supply or intensive blood vessels around the placenta. So therefore, during early development, there is intense development of blood vessels around the placenta. Why do we have a lot of blood vessels there? Because they will be aiding the communication. They will be aiding the signaling. They will be aiding the blood circulation. They will be aiding the oxygen and whatever nutrients required by this fetus. Therefore, there is development, evolvement of new blood vessels. Now, in people with pre-eclampsia, or who are prone to getting preeclampsia, they develop blood vessels that are weak. Blood vessels that cannot carry out their functions very well. Blood vessels that are not elastic. They are fragile. These blood vessels cannot carry out signals from the mother to the baby. And therefore, that's where the problem is going to happen after a cascade of events from the hormonal interplays and so on. That's how a woman will end up with pre-eclampsia. The origin is at the placenta. However, science has also determined or found out women who are at risk of getting preeclampsia. So if you are at risk of getting preeclampsia, I will tell you what to do down in the prevention measures. Now, if a woman has been hypertensive, a hypertensive woman, a woman who usually has high blood pressure, you are at a high risk of getting preeclampsia. Women who are delivering or conceiving for the very first time, first pregnancies, are also at a higher risk of getting preeclampsia. Why first pregnancies? Because remember, with the first pregnancy, the uterus is not used to this activity. The body, the brain, everything is not used. They are not used to this activity of providing intensive blood supply, creating a lot of blood vessels around the placenta. And therefore, this act of creating a lot of blood vessels may happen with a mistake. So when mistakes happen, you end up getting preeclampsia. So this is very important. However, the most important and the commonest risk factor here is new paternity. What do I mean by new paternity? you find that a woman, the first pregnancy had a different father. The second pregnancy, a different father. The first pregnancy, it is John who was responsible for it. The second, it is Geoffrey who is responsible. The third, James. The fourth, Uthuman. The fifth, every pregnancy has its own father. You are changing men like clothes. This will put you at a great risk, my sister, of getting pre-eclampsia. This is going to put you at a great risk of getting pre-eclampsia. Therefore, studies have found out that around about 60% of women with pre-eclampsia, you find that it is mainly like their second or third pregnancy, and those pregnancies have different men. Therefore, my sister, before you get another man for the second pregnancy, for the third pregnancy, think about this monster called pre-eclampsia. Another risk factor is age. Actually, elderly women and very young girls are also prone to getting pre-eclampsia. Obesity and diabetes. I told you in one of my videos that I have not seen any importance of obesity throughout my years of studying and work experience in my work as a medical doctor. I have not seen any benefits of obesity. Therefore, endeavor not to get fat. Endeavor to reduce the body weight. Endeavor not to enter into obesity. Here, obesity comes as another risk factor for pre-eclampsia. Another risk factor is women who produce, I talked about when I was discussing family planning, I was discussing about child spacing. There are women who do not space their children well. You had a pregnancy last year, this year you are pregnant. You are prone to getting pre-eclampsia. So having a second pregnancy or the next pregnancy before 2 years, you are at a great risk of getting pre-eclampsia. So you should have some space. Give it 3 years. Give it 4 years. Above 2 years, 3 years, 4 years, 5 years. However, also do not go high above 10. Because also women who are having a child after 10 years, are also prone to getting pre-eclampsia. So it should be moderate. The spacing should be moderate. Now, if you have history, for example, your sister had pre-eclampsia, your mother had pre-eclampsia, my sister, when you conceive, be alert that you are at risk of getting pre-eclampsia. So family history of pre-eclampsia is a risk factor for pre-eclampsia. Also, twin pregnancies or multiple gestation. This is not so much, but studies have also found out that twin pregnancies usually have pre-eclampsia. Now, another one, which most of you will debate about because you're yearning for, is IVF. IVF, it is said that pregnancies conceived via IVF are at a risk of getting pre-eclampsia. Now, what are the complications? So what happens when you get pre-eclampsia? What are the complications? What are the danger things that can happen when you develop pre-eclampsia? One of them is eclampsia. What do I mean by eclampsia? Eclampsia is a severe untreated form of pre-eclampsia. When you have pre-eclampsia and it is not treated, it may end up becoming eclampsia. What marks the beginning, the end of pre-eclampsia to eclampsia? Now, with the other signs we've talked about, high blood pressure, swelling of the legs, increased urine, proteins in urine, with all those signs, when a woman gets fits, when a woman convulses, you've been having this woman, or you've been there with these signs, and probably they have already diagnosed you in the hospital, they are saying you have pre-eclampsia, and all of a sudden you see yourself shaking, convulsions, as if you have epilepsy. My friend, you've already entered eclampsia, which is a very dangerous form It is very, very dangerous. It is very dangerous, and I will tell you when we reach management how we do this, or how we deal with this. Now, another complication, when you have preeclampsia, it may be managed. We shall look at the management, how you can treat it. But you can have a long-term complication of fetal growth restriction. By fetal growth restriction, we mean this fetus is not growing well. Actually, a baby probably at 20 weeks is supposed to, maybe at 30 weeks is supposed to have this weight. But you find that your baby the weight is very low. The baby is not growing well. There is fetal growth restriction. These are women, actually, on several occasions I've heard women who are saying that they were bewitched, that they delivered at 12 months. Someone bewitched me. I hear they tied this pregnancy onto me. They did some witchcraft. At times it is fetal growth restriction. The fetus may be restricted, and actually you may have the delivery after past the 40 weeks which are known. And this is called fetal growth restriction. And one of the main causes of fetal growth restrictions is eclampsia, pre-eclampsia. Now, another complication can be preterm birth. What can happen during pregnancy, during preeclampsia is preterm birth. You may lose your baby before term, before the baby is mature. You may lose the baby. You can have placenta abruption. Placenta abruption, I will discuss this placenta abruption in details in one of my next videos. But it is when the placenta separates from the fetus, or I mean from the uterus. That is placenta abruption, which is also dangerous. You can have multi-organ damage. I have told you in my opening statement that pre-eclampsia is one of the main causes, or the leading causes of maternal child death or maternal death. One of the causes of death of a pregnant woman. One of the main causes is preeclampsia. Now, how does it bring about death? Is by causing multiple organ damage, multiple organ failure. It is going to affect the kidneys. Actually, it affects the liver first. When it affects the liver, the heart is affected. The kidneys are affected. Of course, eventually, the brain will be affected and kaput will be dead. This is how this monster kills our women. And that's why we need to understand it very seriously. And fellow health workers should detect it early and do something about it. It causes multiple organ damage and failure. And this also happens when a woman gets HELLP syndrome. There is what we call HELLP syndrome. By HELLP syndrome, this is a condition whereby pre-eclampsia has severed. It has become too much to an extent that there is hemolysis of blood vessels, of blood cells. So your blood cells get broken down into pieces. What will broken red blood cells do to the body? The person will lose blood, of course. They are breaking down. Hemolysis. They are being destroyed into small particles that cannot do anything to the body, and that is called hemolysis. There is elevated platelets. Elevated liver enzymes. Elevated liver enzymes. The liver enzymes, that's why I told you it causes damage to the liver. And this is what is bringing about the death. And of course, lastly, the cardiovascular diseases. Cardiovascular injury. This eclampsia is going to lead to cardiovascular injuries. And that's how our women die. Actually, it starts as a simple thing. I am feeling headache, as if I'm not seeing very well. You see your feet, they are swelling. You go to the hospital, they check your blood pressure, it is high. You check your urine, it has bubbles. Preeclampsia. And then you start getting herbs from wherever. People will start telling you you've been bewitched, especially in Africa. When something happens like that, they will tell you your co-wife bewitched you. Your aunt who doesn't like you bewitched you. And now you start going to those witch doctors. By the time you get to understand that it is not related to that, the organ damage, liver down, kidney down, the heart is down. What is left? The brain, kaput. The woman is dead. We need to understand it. That is why even when you delivered a long time ago, you no longer deliver, you no longer want a child, please inform others. Inform others about preeclampsia. You have a friend who is pregnant. You have a friend who is planning to get pregnant. Send them this information. Talk to them about preeclampsia because it is deadly. It is deadly. It is not something to joke with. It is deadly. It has claimed lives when I'm seeing. It has claimed lives. They bring it to a woman, before you even check anything, she's gone. With a baby. She's pregnant with twins, with triplets, with her precious baby. She's gone. This monster needs to be discussed. We need to know it. So how do we treat preeclampsia? We don't just lament about preeclampsia, talk about how bad it is, how it kills women. We must understand, we must be serious on management of preeclampsia. I want to let you know, every follower of mine, whether you're a health worker or a patient yourself or a pregnant woman yourself, get to know that pre-eclampsia is an obstetric emergency. Pre-eclampsia is a maternal emergency. When you go to the maternal ward, when you go to an obstetric hospital, when you go to a gynecologist, when you go to a midwife or any facility managing pregnancies, and you present with pre-eclampsia, it will be treated, it will be handled as an emergency. By an emergency, I mean anything can wait but this. Anything can wait but pre-eclampsia. So what is the goal of treatment? We know that it has brought high blood pressure, and it is this elevated blood pressure that is causing everything. The first issue is to make sure that you taper down, you pull down, you reduce the blood pressure, you normalize the blood pressure. Therefore, your doctor, your health worker will give you antihypertensives, will give you drugs used in managing high blood pressure. The usual drugs. Of course, there are those selected. When the pressure comes and it is very high, we shall give you IVs, drugs via the cannula, the veins. Hydralazine is there. There are several other drugs that can be used to put down this blood pressure. So the first goal is to normalize the blood pressure. There are levels that are needed. Of course, we also don't put it down very fast at once. No, stepwise until it's normal. Then the second issue is giving a drug, which some people call a muscle relaxant, others call an anticonvulsant, and it has other roles, of course, it does in the body. But this is a wonder drug given in preeclampsia called magnesium sulfate. Now, my friend, when you go to the hospital and you have preeclampsia, they will give you magnesium sulfate. There is a way it is given. It's an injection at your butt, at your buttock, and then others are injections through the veins. I'll not explain in deep how they are given, but just know that they will give you that injection, and that injection is also aimed at stopping escalation of preeclampsia to eclampsia, because I told you eclampsia is when fits, all convulsions set in. Then, when the baby is below 34 weeks, they may also give you an injection called dexamethasone. Dexamethasone. The role of this injection, now this one is not for you, the mother, but it is for the baby. It is to cause the maturation of lungs. Because we know that by 34 weeks, the fetuses or the baby's lungs are not yet mature. So why they give dexamethasone is to cause maturation of lungs. Why are they causing maturation of lungs? Because we know that if all doesn't go well, we must deliver. Actually, what I am saying is that with pre-eclampsia, when it goes to severe pre-eclampsia and it threatens your life, and we feel like it is now going to enter eclampsia, we feel like it is going to cause organ damage, we feel like you're entering the HELLP syndrome I am discovered. Now we shift the goalposts. The aim, the goal will be to deliver as soon as possible. We shall have to deliver this baby as soon as possible, whether it's mature or it's still very young. We have to deliver by either inducing, we can induce labor, and you deliver. The goal is to deliver as soon as possible. Or a decision can be made for you to have a cesarean section. There are a lot of other factors considered to decide whether induction or cesarean section. For example, if you had a previous scar, like 2 previous scars, of course we can't induce. When you already have 2 cesarean sections, it will be another cesarean section. So in other words, we shall do a cesarean section unless there is a we shall do induction unless there is a contraindication to induction. But also the severity can give us what to do. For example, if there is no the maternal condition is not good, the woman's health, the woman's no longer has any energy to push, is just there, cannot do anything, is very weak, then of course it will be a cesarean section. So there are several other factors we look at to decide whether induction or cesarean section. But the issue is deliver as soon as immediately. So that is how it is managed. But now we shouldn't allow it to come so that we manage. We should prevent it. How do we prevent pre-eclampsia? Number 1 is to do antenatal. Attend antenatal visits, go for antenatal care. In one of my videos, I'm going to talk about antenatal care. So you should go for antenatal because these early signs, blood pressure, proteins in urine can be detected during the antenatal visits. Then, if you are at risk, we talked about the risk factors. If within that circle of people prone to getting preeclampsia, then you are advised to start taking aspirin, a low dose aspirin at 12 weeks and above. And also, you start taking calcium supplements if you have low calcium. I would say pre-eclampsia is one of the leading causes of maternal death in the world. Therefore, every pregnant woman, every woman who intends to get pregnant must learn this information. If you'd like to get in touch with me to have a private chat, go to my website www.druthman.com, book an appointment. I'll be there to chat with you. You can also find us on all our social media platforms. The name is Ask Dr. Uthuman. I sign out.
Ask Dr. Uthuman on Masawa Wall.